All right. Well, happy Thursday, everyone. And hopefully you can't hear it, but once again, someone's mowing their lawn outside my window, which seems to be a very frequent occurrence. I hope everyone's doing well, staying cool for those of us in experiencing some pretty hot weather right now. And we have another packed call today for you. So as a reminder, all lines will be in listen-only mode, and you'll be able to unmute during Q&A. If you have any questions, you can contact Jess Cohen, and you can chat with us either to the panelists if you have any issues, like technical issues, but if you have a content question, we'd love for you to chat it to everyone so we can all engage. So we'll start with the typical welcome legislative update from AMCHP. We'll have an MCHB update. We have a guest today from ACF's Children's Bureau. Thank you so much for joining us. This was a request that was made in some of the post-call surveys, so I'm glad that we were able to secure a speaker from the Children's Bureau today. And then we're going to hear from two parents who are going to share their experiences and perspectives on school planning, school reopenings. We had a great discussion 2 weeks ago with Dr. Beers from the AAP, and now we want to talk a little bit about it more from the family perspective. And then, of course, we'll finish up with Q&A, but feel free to type your questions as we go along. So legislative update, and I should say, I captured this slide, I guess, 2 days ago, July 21st, and since then, the COVID relief package is in some trouble. There was supposed to have been a Senate package released this morning that was going to be the Senate, essentially Republican offering to the House Democratic passed plan of the HEROES Act, which was back in May already. And there have been a lot of disagreements apparently between the Republican caucus itself and even between the White House. And so Senator McConnell had to drop his plans to introduce the bill this morning, and instead it's going to be released on hopefully next week. But time's running out. I think some of the unemployment insurance provisions run out as soon as next week as well. So hopefully, as normal, you know, the pressure to act and the deadline will spur them into action. But it was a little discouraging to hear that there's still so many outstanding issues, because just a Senate introduction is only the next phase in the negotiations, right? They still have to negotiate with the House bill. So we'll be watching closely for that. I imagine what it means is that some of the other provisions that we were trying to get into the bill may take a back seat as they try to work out what are seen as the bigger ticket items. So, you know, we've been pushing for things like increased funding for Title V or greater support for MCHB home visiting. And I'm feeling like it's less likely to see things like that in this bill if they aren't seen as like responding to emergency needs right now, but we'll see what happens next week. On appropriations, so next week the House will vote on a package of bills that includes the labor HHS appropriations. So as we discussed last time, the House Appropriations Committee did pass a bill out of their committee that would include a $25 million increase for the Title V maternal and child health services block grants. We were pretty happy to see that. But again, even if the House passes it next week, we still have to wait for the Senate to act. With the COVID bill, you know, taking longer to get done than we initially thought, then of course that's only putting appropriations back even further. So still most likely scenario will be some sort of continuing resolution until after the election. And with those cheery updates, I will turn it over to Dr. Warren from MCHB.
Thank you, Amy. Good afternoon, everybody. It is good to join you as always, and excited that you're going to get to hear from our colleague David Kelly from ACF later on. The MCHB really enjoys a strong working relationship with the Children's Bureau, and I know that you all at the state level in Title V programs work closely and it's necessary for you to work closely with your state child welfare programs. And so we appreciate our partnership at the federal level, and glad David was able to join for an update later today. Just a few updates from the Bureau. If we'll go to the next slide. We have continued our Well Child Wednesdays campaign. Yesterday was week 6. We've got one more week of the campaign. As you all know, we've talked about before, it's across HRSA's social media platforms. And just to give you an update on the next slide, when we showed this map 2 weeks ago, 19 of the states were involved in sharing messages either through their health departments or health centers. If we could advance to the next slide, please. And this week we are up to 41. So you'll see all those states that are shaded in orange there have shared those messages. So thank you for the states and jurisdictions that are not highlighted there. You've got another opportunity if you will take advantage of that next Wednesday, either through your state agency or in collaboration with partners or health centers, help to share that message. That would be helpful. One thing that we are trying to accomplish here, in addition to getting this messaging out, is that if these messages, if the amplification is well received, that actually gives us a little bit more ability to leverage additional MCH related posts through HRSA. And so we are hopeful. The response has been so robust, we are hopeful that we will get additional support moving forward for this kind of messaging. But know that your amplification of that message helps. We are hearing from partners across the country that families are engaging pediatric primary care providers, coming back to care both for well child visits and immunizations. And so we are excited about that. I did mention, I think last time, that during the month of August, HHS across the department is going to be doing a promotion for catch-up immunizations, recognizing that lots of kids have missed immunizations throughout the pandemic. So it's a nice follow-on to Well Child Wednesdays. It's also a good segue as we move toward influenza season and thinking about getting kids and families in for seasonal flu vaccines. The next slide just shows specifically health centers that are sharing this. Again, community health centers like FQHCs that are amplifying the message. So some great amplification in Utah, Kentucky, and Colorado in particular over the last few weeks. So thank you for that. Thanks for continuing to share that message. The other quick update I was going to share with you, I had the opportunity to be on a call yesterday that was hosted by Family Voices, the national association, and the call was with F2F organizations across the country, and some really powerful perspectives from the leaders of those F2Fs who are working directly with families every day. And so that has been for a long time an important component of our Title V program and engagement with families. It just reminded me to encourage you to make sure you are staying connected with them, particularly during these times. I'm excited that today we're going to hear from family members on school perspectives. We heard a lot from the F2Fs yesterday about school reopening and concerns, everything from resources for kids who may have special healthcare needs to very practical considerations like broadband access or devices, and employment issues with families. So I encourage you to stay connected with your F2Fs and with family leaders in your state as you work to support them in navigating through. So that's our update from MCHB. Look forward to the rest of the call. As always, if you have questions or need something, please don't hesitate to reach out to us.
Great, thanks, Dr. Warren. And I'm not even kidding. While you were speaking, I got a phone call reminder of my daughter's well child visit tomorrow, which we had postponed because her birthday was at the end of March, but she's 3 and wasn't due for any vaccines. But now we're going to catch up and still make sure she gets seen and evaluated. So
all right.
Seriously, just came right now while you were speaking. Next, I'm going to turn it over to David Kelly, who has graciously joined us from ACF. And I actually didn't make a slide for you, I'm sorry. So we'll just keep it on the HRSA slide for now and take it away.
Thank you so much, Amy. Can you hear me okay?
We can, thank you.
Okay, I don't always successfully navigate the mute button. And thank you, Dr. Warren, for inviting us to be a part of this. I'll be pretty brief and informal, and I'm glad to answer questions and provide some additional material after the fact if interest is there. But we're just delighted to have the opportunity to speak with you today. I'm sure there's pretty decent familiarity with child protection in the United States, and the Children's Bureau is the key agency at the federal level that provides support and funding and technical assistance to state and tribal child welfare agencies around the country. And we've been at it for a while. I think over 100 years now. We're one of the older federal agencies that works in this space. And the truth is, historically, we just haven't been as effective as we could be, should be, or want to be, both at the federal level and in the ways that we support states and tribes. And that's led to some real challenges with how well state and tribal agencies can support families. And we've really been on a mission for the past 3 years to really reshape, rethink, reimagine what child welfare could be in the United States. Historically, we've been very reactive. So we're a system that doesn't typically in the past get involved until something bad has happened in a family, that a child has been hurt in some way or neglected. That is a core function of our work, to be able to help support systems to respond in those ways. But we think it's really, really important to be a participant in every way that we can in helping prevent that trauma from occurring in the first place. From helping make sure that families are better supported through primary prevention, so that they have the resiliency, the protective capacities to overcome adversity and hopefully reduce the likelihood that a child will ever be abused or neglected in the first place. So this has really been our charge and our focus. And we've literally traveled around the country back when travel was possible, and have spent time in most states, 42, 44 states, something like that, often multiple visits. And our intention in doing so has been to meet with the parents, the families, and young people who have made contact with the child welfare system, to learn about their experiences, to learn what was helpful, what was not, what would have been more helpful had it been provided. And it has been a nonstop learning process. It's been quite difficult at times because unfortunately most of the stories we hear are not as positive as we'd like them to be. Parents, families, young people who have experienced our system use words such as intimidation, overwhelmed, being scared, not being seen or heard, being judged, ashamed. Words like those are the words we most typically hear. And those aren't the words that any of us in this field want to be responsible for generating. We'd like to hear words such as supported, empowered, cared for, nurtured, far healing or healed, far more positive words. And our goal is to take new approaches, form stronger partnerships, model those types of partnerships at the federal level, make them more possible at the state, tribal, territorial, and local levels, so that we can work together to create the conditions for strong and thriving families and communities, where children are free from harm and can reach their best potential. So at CB, we've been looking at the Children's Bureau for every way possible that we can align policy, resources, and funding to try to help allow child welfare systems, child protection agencies, to partner in more expansive ways, far further upstream, with the idea of strengthening families, strengthening communities, preventing unnecessary trauma. And we couldn't possibly express how much we respect your work and how much we have to learn from your efforts, broadly at HRSA, more specifically at MCHB, because you have long worked in the space that we feel a need to move into and become better partners with you on. We think it really oftentimes is so simple as, what children need most is for their mothers and fathers to be healthy and well, so that they can best meet a child's needs, and that it's really just so simple as ensuring that basic family needs are met, basic supports, so that issues of poverty and difficult challenges that come up with so many of the families that we come to know in child welfare can be addressed. And hopefully we can interrupt what are often very harmful intergenerational cycles. That's what we have been so dedicated to doing, what we want to do more of, and why we're so excited to have some time with you today. I'm very excited to say that this is not just an effort within the Children's Bureau, but under the direction and leadership of our Assistant Secretary at ACF more broadly, this notion of primary prevention to strengthen families and to ensure healthy childhood development, along with a real commitment to economic mobility, and really trying to help tackle the root causes of family vulnerability, are the two organizing principles that ACF has committed to as well. The last comment or two I would like to share, and then I'm glad to take questions or do whatever is most helpful to the audience, is that like all of you and all other human service entities and in offices, agencies, organizations, we've been called to the huge challenge of trying to help respond to the pandemic in as helpful a way as we can. And at the Children's Bureau, what we've tried to do is look for flexibilities that will enable child welfare workers on the ground level to continue their really important work of supporting families, of responding to reports of child abuse and neglect, and for facilitating continued time for parents and children who are currently separated due to foster care placement to remain in contact, so we don't lose important bonding time and relational ties between parents and children who may now be separated. And we know there are around 437,000 children in foster care right now that are not with their parents. They're in temporary substitute care, foster care. And we are, paying very close attention to what research says about healthy brain development and bonding. And we want to do everything we can to make sure that children and parents continue to see each other where that may be safe, and that we use technology to try to fill in some of those gaps where it may not be possible. So there are real challenges that we're trying to be helpful in addressing. There are also some great opportunities. We've said quite often that the pandemic has exposed some very serious shortcomings, many of which we were aware of, but now they're in a much brighter light. And we have now an opportunity and a responsibility to adapt and respond so that we can more thoughtfully position states, tribes, and territories to be there for families, especially now in times of such extreme need, and in a time where we know families need more support than perhaps ever before. And we are at the ACF level deeply involved in crafting strategies and approaches so that we may better align internally to be a more cohesive, better integrated source of support for whole families, as opposed to operating in silos as we so often have historically. And we really look forward to partnering with HRSA and MCHB as we move forward in really positive ways.
Great, thank you. I know we had a question in the chat about specific challenges in light of COVID and reports of increased domestic violence. Anything to add on your efforts in that area?
Well, our area of focus is at the Children's Bureau, where I sit, is primarily focused on child abuse and neglect. There have been numerous media stories and a lot of concern out there publicly that there'll be very large spikes in child abuse and neglect. Some pretty powerful and often disturbing words are used, such as a surge or a tsunami, words that are most typically associated with natural disasters or war, frankly. But so far, we don't have data to suggest that reports or incidences are on the rise. In fact, what we do have right now in many jurisdictions are far fewer reports coming in, and there are different ways to interpret that. So we're not leaping to any conclusions here, but we are seeing larger numbers of reports to what we would call helplines or warm lines, or family resource centers and community centers that have really stepped up to fill gaps in terms of food insecurity, assistance with utilities, getting access to supplies, and just the basic life necessities that so many families need. And frankly, when those needs aren't met, can be really powerful sources of stress that could contribute to potential instances of neglect or abuse. So right now, we just don't have enough information to know what the reduction in reports to child abuse lines means. We do know that under normal times, the vast majority of calls that come in are screened out, that they're not substantiated in the first place. And right now, although we can't make these comparisons, most reporting lines that I've seen are down someplace between 40 and 60%. And as it turns out, in normal times, that's about the percentage of calls that are screened out or unfounded. So it's going to be a time of critical examination for us as we learn more. The one thing we do know is that there certainly are heightened risk factors for maltreatment right now. And what we'd really like to see mobilization around is how do we work with families to provide what they need to address those risk factors. Domestic violence, all the same risk factors are there. They're all heightened. I think that they're, even though this does not fall into my office, our sister office, the Family Youth and Services Bureau, which is part of ACYF, does a lot of critically important work with respect to domestic violence, including support for a wide range of programs that operate in that space. And the data that I have been aware of, which clearly are limited, do indicate, I believe, that there's serious concern about rises in domestic violence, and that's something we're quite concerned about and want to do what we can to help abate, because it does often affect children in very harmful ways as well.
Great, thank you so much. I hope you'll stay with us because we'll have more Q&A at the end, but now I'm going to turn it over. We're fortunate to be joined by two parents who are going to share their perspectives on school reopening plans. So I'm going to start with Dawn Bailey from Arizona. She is an AMCHP board member, and she is a member of Arizona's Long-Term Care Services Advisory Council since 2017. She's also the mother of a 14-year-old daughter with complex medical, cognitive, and physical conditions due to a rare genetic chromosomal abnormality. And so she's had 14 years of experience learning to navigate the vast systems of care that her daughter needs. And she's really been committed to using her experience to collaborate and improve systems of care. I know that she has been very involved with the conversations going on in Arizona. So Dawn, can I turn it over to you?
Thank you, Amy. Can you hear me okay?
We can, thanks.
Great, thank you so much. Well, I appreciate the opportunity to have a chance just to kind of share some of the concerns and thoughts around school reopening. I'm sharing today as a family leader within my community, and also, like Amy said, as a parent of a child with very complex medical conditions, including cognitive and physical disabilities. So a few things that I think are of concern is that, we always say that everything we do should be inclusive of all children and all families. We all know that the onslaught of COVID-19 has certainly halted or fractured our healthcare and our current education systems. For our populations, we know from experience that these systems are often already fragile. And so for many, we were the first to experience a halt in care and services and the educational needs from the beginning. And sometimes too often we're the last to be addressed or part of the fix. And I'm concerned that we're kind of seeing that sentiment right now as it relates to the reopening of our schools. In my state in particular, even some of the most recent guidelines from our Department of Ed does not include any specific guidelines related to children and youth with special health care needs. And for this, I include those with 504s, IEPs, our broad definition of children and youth with special health care needs. Really, what we've only seen is limited guidance for those providers that may be providing related services within a school setting if schools are reopened in person. We've had some press coverage here in Arizona related to this, and when some of our local districts are asked about how they're going to be addressing these needs, they point back to they're looking for guidance from the state. When we pushed kind of at the state level, we're told they're basing their guidance on what they see federally, whether that be currently from what the CDC has put out or AAP or so forth. I think we also have to be very mindful that, there's not a one size fits all across the board. Virtual versus in-person models are going to affect our populations and children in general very, very differently. Some of the concerns we've seen is that if we look at in-person education with current CDC guidance, we have had some families being told that because their child has enhanced ratio in their program or one-to-one, that doesn't fall in line with social distancing, so they cannot return to in-person. I think we have to be mindful that if in-person is made available, there are many within our population that would benefit better from that in-person learning. And so it's clear that we need to be thinking about what kind of guidance can we offer for those special considerations. And then if we are looking at a virtual only for a time period, we have to be mindful of what that's going to look like, even within the vast population of special education or children and youth with special health care needs. For example, I asked my daughter's school in particular, because we are looking at virtual for the first quarter of the year, with you maintaining staff but no kids on campus, could we look at having some of the para or educational supports come to the homes periodically throughout the week to help with some of that in-person instruction if it's safe to do so? But I think, we as families are having to constantly push these questions and these conversations, and we need our systems to be helping to address that as well. At the same time, we recently saw this week that the School Board Association and the superintendents are actively advocating Congress to limit their legal protection or legal liabilities from IDEA. As a parent, I find that incredibly concerning. I think that instead of asking to be held, being let off for not having to fulfill your legal obligation to our population, we should be working with families on, do we create modified IEP or 504 plans for this during this time? We should not be accepting the idea of going backwards on decades of advocacy and laws that protect our rights. I think many of our families struggled even before the pandemic with our education systems living up to the legal obligations under these laws as it was. The last thing we need to do to go even farther back. I think most families right now recognize that we are in very uncharted territory. I think we all know that there are going to have to be concessions, and but we want an effort of that conversation and that engagement to be made to look at what can we do for our children rather than the focus of what we just can't do, period. And I think experience tells us, we know that when we engage our community, we have better success and outcomes. I think most people who deal with our families will tell you or realize that we are incredibly adaptable by necessity, that we can often find ways over, under, and around barriers because it's for the benefit of our children and our loved ones. And I think it's a treasure of knowledge and innovation that should be engaged to help guide us through this and to include these conversations rather than viewing it as a large mountain that nobody thinks we can climb, so we need to just keep putting it off. We also know, and we have shared, I think, just from a Title V aspect, that when we build programs or systems for our more complex groups, we build better systems for all. And I think in the COVID era, we have to look for those silver linings, and what better opportunity would be to look at working on more inclusive education and curriculum models that can apply to multiple learning styles and kind of stretch ourselves for even pushing us further down the road. I was reminded yesterday on a webinar from another fellow mom and advocate who I admire greatly, that for a lot of us, we aren't just now having to navigate what does education look like. We're continuing to navigate the challenges of the health and medical needs for our children, both of which are greatly impacted by COVID-19 right now. You know, we can't just escape the reality of what we're dealing with, and we need our community to remember us as well during this time. So, you know, I think that it's a hard task. There's not an easy solution, but we can't even begin to address it if we're not even having these conversations in the right context. And so I'm hoping that our families and our advocates out there that are also championing this can kind of bring that table to light, that we can all sit around and make sure that as we're looking at reopening schools, whatever that looks like, that we're not forgetting about our population of children and youth with special health care needs. So thank you for allowing me to share. And if there are any examples of these conversations happening that can help leverage work here in my home state or others, I would love to hear it, to be able to push that. And I appreciate the opportunity to just share my reflections.
Thank you so much, Nan. Really appreciate your thoughtfulness in distilling, you know, both what has gone not so great but also offering really great solutions and suggestions for moving forward. Oops, I'm going backwards. Okay. So we'll hold on for Q&A until after our next presenter. Dewey Sampson is a native Washingtonian, as in DC. Most recently, he served as the Director of Programs and Director of Alumni Affairs at an independent school focused on underserved and low-income boys in Washington, DC. Recognizing, excuse me, a large gap in community resources for fathers and male caregivers, Dewey created Fathers of Superheroes, a support group for fathers and caregivers of children with developmental and sensory differences. Dewey is the father of an awesome 5-year-old, Dewey Jr., who is also on the autism spectrum. And Dewey, I'm going to turn it over to you. Thank you.
Oh, awesome. Thank you very much. Can you hear me? So thank you for having me, first and foremost. Like Dawn, we've experienced a lot of pushback, I guess, with regards to how we're going to reopen here in the fall. So just a little bit of background. So when COVID first hit, I didn't necessarily feel as though what the classroom or the virtual learning was up to snuff for what I wanted for my child. You know, the first day that we arrived, we had one song and we read one book, and that was the extent of how virtual learning was going to go. So at that point, I actually got in contact with all of his therapists. He does the whole array. He does ABA 4 times a week. We got speech increased to twice a week, OT, and physical therapy increased as well, because I saw that there was going to be some information that was lacking with regards to the virtual education that he was going to be receiving. So the interesting thing about Washington, D.C. Is that we are surrounded by obviously 2 other states in a very close proximity. So I could be to Virginia in 7 minutes right now, and I could be in Maryland in like 15 maybe at the top. So what I found has been really interesting is that there doesn't seem to be that much communication with regards to how this is gonna work. DC is a transient city by nature. So we have students that don't necessarily live in Washington, D.C. that still attend our school. They come from Maryland, they come from Virginia, et cetera, et cetera. And so what I've had a lot of issue with is that as of right now, Fairfax County just decided that they're going to be all virtual. They're out in Virginia. Prince George's County has also stated that they were going to be virtual for the first, until January. We have been lagging behind a little bit here in the city. We were also the last school system in this area to close down. I have family members in Prince George's County, and their kids their school system was actually closed a couple of days before ours. I want to say maybe 4 days before ours was. And so as of right now, I don't feel comfortable sending my child back to school in about roughly a month. Last week, our mayor was to have a conference at a middle school to show how this was going to work. The conference was abruptly ended, and they actually did the conference at, I believe it was the Wilson building, her office. So it doesn't necessarily make parents feel that much better at this point. I have been on several calls with the school. I have been on calls with the city as well. And like Don said, the CES program, which is the Communication and Education Support Program here for children with autism and special needs, seems to be placed on the back burner. And so, it's a constant fight to have our voices heard, very much like Don said, but we are still moving in a direction, and hopefully we'll be able to figure something out in the near future. So with our CES program here in DC, the only thing that gives me a small bit of hope with our CES program is that in the program, you can only have up to 6 children per classroom. And if you think about it, the social distancing that could be done with that, it could be done. But on the back end, we also understand that our guys and girls also are going to be standing up. What happens if my son stims and he likes to walk around, and so it's going to be more difficult to get that accomplished as well. As of right now, I don't feel comfortable sending my son back to school. And if I have gotten in contact with his principal, and if what was provided to us with regards to virtual learning is where we're going to be in the fall, I don't know if that's going to be acceptable as well. We've had a promise that was not going to be a reoccurring theme, and that it was going to be more robust. But at this point, we're still waiting to actually see an actual plan. It's troubling, obviously. I want to go back to work. I completely understand that, but I also understand that I have to do what's best for my son. And in my case, with the situation that I'm in, I am a single parent. Unfortunately, last year I lost my wife in September. So I get a lot of help from my family. And most of my family that help out, my aunt is older, and she has some of the underlying issues. My dad is the same way. And, it's just like, I don't know if I feel comfortable sending him into that environment and having the possibility of anything happening to anyone else in my immediate family. And that's what I'm struggling with on a day-to-day basis at this point.
Thank you so much for sharing your personal perspectives as well. Up here in Montgomery County, they just made the decision, I think about 2 days ago, to go all virtual as well. So it's
and that's my point. We have so many different agencies that aren't working together. It gets to be very difficult. And as I stated, we're a transient city, so we're still going to have kids coming in from all over. And, Mayor Bowser has done a lot of good things. In this situation, I don't know if this has been handled the way that it needs to be handled.
It's fair. Dawn, maybe I'll ask you to come back on as well and ask both of you, about opportunities for greater engagement with parents. And I think one of the things that we've been talking about, both internally at AMCHP and in some of these previous calls, is also how to foster those relationships between health and education sectors. So I'd love to hear both of your thoughts on that, and also if any of our participants want to share what that experience has been like in their state as well.
Sure. You can go first, Dawn.
Thank you. Thank you, Dewey, for sharing your story. And I can relate to so much of what you said as well. So I'm glad to know, we're certainly not alone in this challenge as well. So, I mean, I think there's lots of opportunity. If I'm perfectly honest, I think Jonathan had challenged us a few times in the past about, find the table and get yourself to the table, or, and if you can't get there, find your chair, bring your own chair. And I've really been working hard here in Arizona to try to do that. And I've really struggled to meet that challenge. I've kind of vocally expressed with our Department of Education here in Arizona that they need to be engaging this community, that this stakeholder group that they compile to put out the guidance for the state. We're all very agency-related individuals and not community-based. And even within that, our Title V SHIN program was not included or, able to participate in that or asked to participate. And so I've tried to push and task them to say, you have got to reach out to this community and engage to figure out, how do we come up with these guidelines? How do we help schools think about what to look for? And really that's going to come from the families, because of not only the concerns of COVID from an educational standpoint, but the concerns of families, of what they're concerned about for their children. Having a medically fragile child, the idea of sending back to school right now is just not feasible. But online is challenging. She has visual and cognitive disease. So what does that look like to, and I think in a way we're forgetting the emotional and social well-being of our kids too, even being nonverbal and the limitations my daughter has. She's incredibly social and she so misses her people, and I think that's where our voice can be helpful. I'll be honest, I'm struggling to figure out how to get those voices to the table. So I think my sharing today is a cry for help in ideas and suggestions of how we do that. And to be honest, Arizona is in the midst of a really, really bad space right now as well. And so I understand to an extent that, there's a lot of pressure and capacity is hard. And so I kind of push back a little bit to our federal partners to help start that guidance and push downward if that can help our state do better too, or ask of them to be willing to take on this conversation as well.
And and to follow up with that, with regards to the outlook for parents as well, it's part of the reason why I started the Fathers Group, is so that we could have those conversations. Unfortunately, sometimes as men, we don't necessarily express ourselves in the best manner. So it gives the dads an opportunity to have those conversations and just be open and honest. And we've tried to continue to have them every 2 weeks throughout this whole process, and just to touch base to see where you are, what you're having difficulty with. Again, one of the issues is that a lot of the guys are spread out. I want to say that there are, right now we average about 15 guys on the call. So I think 3 of us are in DC, we have folks in Virginia, so we're all experiencing different things. But what we can try to figure out is what's the one underlying theme that all of us could use to push the agenda that we're trying to get done. And so, just that that level of communication with other parents is strikingly important. And I think that, you know, hopefully you can find your pod. I know a lot of folks are doing pods and things of that nature. Hopefully you can find your pod for your child and also maybe for yourself as the parent in the situation.
Thank you. I'm wondering if there's any other questions from participants. You're welcome to either unmute yourself or also type it in the chat box. We do have, and just a reminder, if you can try to switch it so that when you send your question, it goes to all panelists and attendees so they can see the question as well. I know for some reason the default setting is always all panelists. So, okay, we do have some questions in the chat that I think just went to panelists, so I'll read them. So the first one from Marcus Allen is, in Virginia is, Dawn, you may have already done this, but it may help to start with your local school board meetings. Some of them are doing virtually and allowing public comment.
Yes, thank you. I can tell you that we, in some of our districts, that has been the route. I think where we struggle is the district's responses. We're waiting for guidance from the state, and so it's just that's the end of that. We've reached out to teachers. You know, like I had a friend whose teacher checked in on them from one of the self-contained programs here in our district, just to talk about what could this look like. And to be clear, we still don't have an answer yet of what we're doing in Arizona. It's varying amongst districts, so there's no cohesive plan from a state perspective at this point. And the teacher was very gracious in trying to come up with thoughts and ideas, but at the end of the conversation, it was, okay, well, I'll email our superintendent and see what they might let me start working on. So there's even that disconnect of our educators and our teachers knowing what are they going to be able to do, what is that going to look like for them, so that they can even work with our families. So, but I think it's still a great suggestion, and one we should keep peppering at. You know, thank you.
Jenny from Hawaii first says, aloha and mahalo to Dawn and Dewey. Thank you for you and your hard work. In Hawaii, they've been having formal and informal table exercises with health and education. So they've used Zoom meetings, social media, television, radio, print, to engage parents, educators, healthcare providers, informal and formal supporters, to parents of like pre-K to 12 students. Says their PTSA, Board of Education, Parent Network has been very busy. So if you have any other, I don't know if, Jenny, if you have anything to share from some of the solutions that have been developed from these collaborations, I think we would love to be able to share those. So feel free to send anything over to me after the call, and we can share it out with participants. Alan Meese from Arkansas says, Dawn and Dewey, thank you so much for sharing. Parenting a special needs child under these circumstances is so difficult, so don't forget to take care of yourselves as well, and thank you for your courage. Do we have any other questions?
Hey, this is Becky in Louisiana. I just wanted to thank both Dawn and Dewey for sharing their stories, and also just for finding the time to really advocate for your children. That's the thing that I'm struggling with, and I feel like I'm a parent of a child with special health care need and another typical child, and they both are in elementary school. So just juggling work and being with them 24/7 and not being able to have all of my support network here because it's grandparents over the age of 70 and just two parents trying to work at home. It's so much that we need our surrogates to think of us. I'm just trying to figure out, how do we get other people to speak up, because it's hard enough to juggle what we're dealing with right now. Right now, I'm just trying to keep up and read the emails that are coming through. So I'm kind of advocating for other people to realize that we might not be able to say what we need right now because we're drowning. And I'm just wondering how you can get other people to bring those chairs to the table to speak up for our children.
So I'll go first, I guess, and know that I've been where you are, especially after everything that happened last year. Just trying to juggle everything that goes along with raising a child with autism or a child with special needs. I think that you just have to keep fighting ferociously, to be honest with you, because unfortunately, we make up a small population. So I think that you just have to continue to fight and, you know, just continue to spread the word. Like I talk to my friends about my son being on the spectrum all the time so that they can get a better understanding of what we go through on a day-to-day basis. You know, I told them when this whole process started that obviously virtual learning was going to be difficult. But what they didn't realize was that on top of virtual learning, he had to go to OT, PT, ABA, and physical therapy. And so, like, until those folks, people don't necessarily know what it really takes to raise a child with special needs. And so you just have to continue to voice your concern and just get that information out there as much as possible. Anybody that wants to talk about the CES program or my son being on the spectrum, I'm in the barber shop. My barbers now, whenever I go in, it's once every 2 months now, but they always find out new information about autism and how they can help cut DJ's hair. So it's basically just going out and just spreading the news and just spreading exactly what it is to have a child with special needs, in my opinion.
And I would certainly add to, and thank you so much for sharing. You know, I'm with Matt, and a lot of times it's hard, and I think that you could do what you can when you can, and it's okay when you can't. And the goal is that as family leaders, we build our network, because we know that somebody somewhere is going to have that voice when we can't, because we just have to take care of ourselves. You know, I've struggled, just to be honest and vulnerable. You know, because of this and the medical considerations and the capacity issues of our healthcare system here, you know, we don't have anyone coming in to helping with our daughter who's full care. So it's just my husband and I, and balancing work and the isolation, and it's hard sometimes to feel like we are being forgotten in a lot of this, because people don't know and understand all the things that we still have to maintain for our children. Exactly what Dewey said: PT, OT, speech, feeding, you know, the ongoing medical, you know, telehealth has been great. But, you know, we had to have emergency surgery in the middle of COVID, you know, and so, you know, those kinds of things just exponentially make it harder. And that's why, to my point, even while we're talking about the challenge of education, for a lot of our families, it goes up beyond education. And so my advice to you is just do what you can when you can, because when you do have that voice, it does make a difference. And know who your fellow families are around you, and know that they can carry that torch when you can't, and that's okay.
Good. Zoom warmed me out. I was on mute. I feel like we could probably continue this conversation, and we certainly can pick it back up on our next call, but I do want to be mindful that it is already 3 o'clock. There was one more question about promising strategies that parent or family groups have developed to use in IEPs to help support online learning. So that's just something to think about as well, if it's something that we can share out. But I do want to mention to everyone that our next call, because the AMCHP virtual conference, which I hope everyone will be participating in, will be August 4 through 6. We are going to move our next call of this series to August 13th, and then we'll be continuing every 2 weeks from then. And we've scheduled them through the rest of the year. So we hope you'll keep joining us and suggesting great topics. And thank you so much to our guest speakers today for just lending your voice and especially sharing your personal stories. I think we put the link to register in the chat box as well. Otherwise, you'll get it as part of the follow-up email. And in the meantime, just wish everybody to stay safe and healthy. And if you need anything else following up, email me, email Jess. And with that, we'll conclude today's meeting. Thank you.